Diabetes was not that common when I started my practice.
Right.
It was common, but not that common.
I think now every third person is having diabetes who comes.
Yeah. Almost every third patient that I see is a diabetic. So it's almost 30%.
Yes. Welcome to another episode of Fit Friday with KG in association with Vadodara. And today, one of the most impeding issues that we have on our country, obesity. And for that, I have come to this amazing hospital called as Intestinal and Obesity Surgery, VGOS. And I am with Dr. Samir Contractor. Welcome to the show, sir.
Thank you.
Sir, the very reason of coming to you, and one of the most proclaimed issues that are happening and that people are very silent about is a thing called as obesity. So can you please throw some light on obesity? Obesity क्या चीज़ है? उससे क्या सब चीज़ें हो सकती है? और what should a person do basically to identify obesity?
Right. So basically obesity is some excess accumulation of fat cells in your body. This is the technical explanation. But for a layman, it's being overweight, right? Measured by your body mass index. That is the easiest way to do, but there are scientific ways called DEXA scan,
right.
which tells you the body fat analysis, where exactly your fat is deposited more.
Right.
Because the places where fat is deposited more is very important.
Right.
If it is inside your tummy, that is the fat which is causing most of the problems.
Okay.
Right. And if the fat is overall, the entire body is fat, but there is very little fat in your tummy, these are the patients who can lead a very normal life.
Though being obese. A little bit chubby.
Yeah, they are little bit chubby, but they are metabolically healthy.
All right.
And they will live as normal a life, as normal a lifespan, as a normal person, a normal healthy person.
Okay.
But there is a dangerous entity called TOFI.
Come again? TOFI.
TOFI, T-O-F-I.
Okay.
This is known as thin on the outside and fat in the inside. And this is the most dangerous thing to have.
Okay.
These are the patients who suffer from diabetes, hypercholesteremia, blood pressure problems, cardiovascular problems, cancers, autoimmune diseases like arthritis and thyroid.
The list is long. The list is very, very
PCOS.
long. Yes.
Polycystic ovarian syndrome, which is quite common in our country, where IVF was actually an unknown entity just 30 years back.
Right.
Now every street has an IVF center in majority of the cities.
Right.
Right. And it is not only causing infertility, but it puts the woman at increased risk of death.
Right.
Increased risk of cardiovascular problems once they cross the menopausal age.
Right. Estrogen levels dropping will cause these.
Yeah. Yes. Lot of hormone, because the male body and the female body, the difference is there is a complex hormonal system in the women.
Right.
Because of the menstrual cycle.
Right.
The male sex hormones are mainly testosterone.
Right.
But the major sex hormone in female is also testosterone.
Yes.
Right? Estrogen and progesterone play a vital role in a woman's health.
Yes, absolutely.
Right? But it's the male testosterone hormone which is important metabolically in both male as well as female.
Absolutely. Sir, I believe, how many years of practice do you have doing this obesity and treating obesity basically?
Yeah, it's almost now. I'm in my 10th year of practice of obesity now.
Okay.
Right.
And you've been practicing from how much time? I mean, as a doctor.
Yeah, I have been practicing since more than 20 years now.
Sir, મને એક આ વાત કહો કે 20 વર્ષ પહેલા, forget 20 years, 5 થી 6 વર્ષ પહેલા, the quality of customer that would come to you and the problems they would get to you. ને આજના તારીખમાં શું ફરક દેખાય છે આપણે?
Yeah, the major change that we have seen in the variety of diseases coming in.
Right.
Like nobody now comes with single problem.
Yeah.
Right?
Multiple.
It's usually multiple.
Right.
Most of the time patient is not aware that this is a problem.
Right. Right.
Right? Because they have come with one problem and their entire focus is on that problem.
True. 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 True.
But it is up to a good clinician
Right.
to identify the other problems which are actually connected to this.
Absolutely. Absolutely.
And that is the most important thing for the patient to go to such a doctor who can actually identify this problem
Okay.
and help you out in the best possible way.
All right.
Right? And diabetes was not that common when I started my practice.
Right.
It was common, but not that common.
I think
Now-
every third person is having diabetes who comes.
Yeah. Almost every third patient that I see is a diabetic. So it's almost 30%
Yes. Now,
national
so
rate.
we're looking at 140 million people who will be diabetic, type 2 diabetics in just urban India.
Yeah.
I mean, that is what the World Health Organization is saying. We've got registered 6.58 crore people who have registered to NCD clinics in the year 2018 itself. So it's kind of an epidemic. But sir, again, I'm coming back to my same question is, the number of people who would come for obesity, we've been doing this for 10 years, the number of people who would come to treat for obesity then, 10 years back, and now, what is the change in the numbers you're looking at?
So first of all, the overall weight has increased.
Uh-huh.
So people with BMI more than 50 is not uncommon now.
Right.
It's quite common. And people with BMI 40 plus is also, the numbers are increasing. So there's a shift from around 30, 35 BMI
Right.
to more than 40, 45 BMI.
So what are the main reasons for this? What is the I mean, I know the reason, but I want you to tell as a doctor, tell the city of Vadodara, what are the main reasons for obesity?
So obesity there is no single factor which is responsible. It's
Right.
multifactorial.
Right.
And after that, the major importance is of lifestyle,
Right.
which includes food, right? So the food that we eat and the sleep that we have,
Right.
and of course exercise,
Right.
So that is these three play almost 80% role according to me, right? And according to scientific data.
Right. Absolutely right.
So there are other 20-25% of the factors, like patients who have some metabolic problems like thyroid, adrenal tumors, yes, women having some hormonal issues,
Right.
right? So there are some other metabolic issues also, and there are genetics is very, very uncommon when obesity is
It
coming
can
in
be
picture.
done by anybody in the family. Yeah.
So genes actually, if you compare genes to your a loaded gun, see, right? What triggers this loaded gun is the food that you eat.
Your trigger is your.
So your lifestyle basically,
Yes. Yes.
right? So sleep, exercise, and food that we eat.
Right. True. True. Sir, I was. I'm studying the subject obesity personally myself since a very long time. I've been treating people with obesity. But the more alarming thing is what I've come to know is that India is the capital for child obesity. I mean, I remember me being a kid. I don't remember having a fat student or a classmate in my class, you know. And from that particular time to now, where we have child obesity, I mean, India is the capital for child obesity. I mean, come on, like it's the number one in the world. So what's the reason why kids are having this? I mean, who's to blame in this thing? Because as a kid, I mean, I wouldn't expect my 15-year-old son to kind of choose all these things. So who's responsible for it?
So this childhood obesity, one of the main hypotheses, still research is going on, but I'll try to explain. It all begins with a obese mother.
Okay.
Right?
Charity begins at home.
Yeah.
Okay.
So if the mother is overweight,
Right.
not necessarily obese, but she's overweight, right? And she is having hyperinsulinemia, right?
I would want you to repeat that.
Insulinemia.
Okay.
So in these patients, there is an abnormal spike in insulin levels with the food that they are eating,
Right.
and over a period of time they become insulin resistant.
Right.
This is a condition which causes the entire spectrum of chronic diseases.
Right, right.
So when a mother is insulin resistant, right, and now it's quite common for the mother to have gestational diabetes. So diabetes detected during pregnancy.
Right, right, right.
So when a child is born to this mother, this kids are already very sensitive to high insulin spikes to the food that they are eating.
Okay.
And what we are feeding actually makes that thing work in unison, right? Because the food that we give to our kids is all processed industrial food, right? No, very few kids eat home healthy food, whole food basically.
Ask me, but I had.
So cereals number one.
Yes.
Right? All powders that we give the patients.
Yes.
Sorry, not the patients, but the
Kids,
children.
Kids, yeah.
Forcing the child to eat.
Yes.
Right? That is another factor in leading to obesity.
True.
Because don't feed your children unless they ask for it.
True.
This is the most important. Every mother in the world wants her kid to eat something or drink something in the morning before going to the school.
We've done this same mistake with my son Vikrant.
Yeah.
So he was so fond, he was so chubby, he was so cute. But his mother would like, beta kha. You want to eat this? You want to eat this? And eventually, he has to really work. Where he's a strong kid, touch wood, but he has to do this work where he needs to lose on his fat level. So I would say mothers are the people to blame the most.
No. Don't blame the mothers because they have been following this myth for the ages.
How should a person identify that he needs surgery? Or he needs to approach a doctor because, of course, they're watching themselves every day in front of the mirror. They're growing, they keep on increasing their BMI, they're becoming fatter every day. There are organizations that sell larger clothes. And these guys keep on hiding it till a point where they cannot hide it anymore. So, what are the ways for them to understand? And I want you to educate people as to what kind of surgeries are available and what is the best way of getting rid of it if surgery is the point.
Okay. So, if somebody who is concerned about his weight, then he should go to a doctor who is specialized in it.
Okay.
Right. So then only they can get a proper advice.
True.
Like if somebody wants advice on how to exercise, what is the right exercise for me, they come to a center like yours.
Absolutely.
Where they are guaranteed, more or less guaranteed to get very honest and straight advice.
True.
Whether the patient wants to follow it or not, it's up to the patient.
Barabar.
But our job in a clinic, our clinic, we basically give a honest profile to the patient that this is what you are having, these are your options.
Right.
You choose.
True.
I'm not going to choose.
True.
Right? Because you have a certain way of thinking and a certain way of understanding, and I'll give you options. You can follow whatever options you feel like getting it done.
Yes, I understand that, right.
So majority of the patients, they are given initial 3 to 6 months of non-surgical advice.
Okay.
Right? Without that, surgery should not be advised.
Right.
These are the guidelines.
Right.
Right? So minimum 3 months of failure.
Right.
In a medically supervised weight loss program.
Right.
Right? If patient has failed after 3 months, and there is a definition for failure also, but if the patient has not lost more than 10% of excess weight, then he is labeled as failure.
Okay.
Right? And if he is getting more than 10%, right? This is hypothetical figure, but it can be 8% also.
True.
But if the patient is determined, motivated, we can still get him to do another 3 months.
True.
And if he is getting benefit, then no surgery. Let him continue for another 2 years.
Okay.
Right?
Right.
Provided he is ready to follow and provided he is getting the results.
Okay.
Right?
Right.
But if the patient is not able to do that, then it is a duty, our duty, to advise the patient that it's better to you go for surgery because you fall in that guidelines. And the guidelines, Indian guidelines are 32.5 to 37.5 BMI.
Okay.
With comorbidities like diabetes, hypertension, hypercholesteremia, sleep apnea syndrome.
Yeah, one of the most common ones. Yes.
And severe ONEs, where they have to undergo knee replacement surgery.
Right.
So before surgery, they should lose weight. So bariatric surgery first, joint replacement second.
Sir, we'll keep on and getting more information for you. So, I mean, for this particular episode, we are going to come in the next episode and give you much more information as far as how obesity surgeries actually happen and how do they help everybody.